Hello and welcome. You're watching Good Morning India. I'm Rishika Barwa. Let's get you up to speed with the top headlines we're tracking this morning. 4 lakh daily cases, 4,000 daily deaths in 24 hours. Mumbai's daily positivity rate falls to 7.3%. In Karnataka, it's gone up to 32.7%. After the massive spike in cases, now a 2-week lockdown has been imposed in Karnataka and Tamil Nadu. The lockdown in Delhi and Haryana has also been extended to the 17th of May. Delhi metro services have also been suspended. '80 staff members at a Delhi hospital test Covid positive in a month. A 58-year-old surgeon dies despite both shots of the vaccine. The central government has defended India's vaccination policy in the Supreme Court, says leave the decision to the executive in the larger public interest. No judicial interference is called for. Hemant Biswa Sarma to be sworn in as the next Chief Minister of Assam. 8 to 9 other ministers could also be sworn in today, say sources. 43 ministers will be sworn in as a part of Mamata Banerjee's team as she begins her third term as Chief Minister of West Bengal today. Welcome back. Breaking news that is coming in. The central government has defended the vaccination policy of the country in the Supreme Court. The centre, while defending its vaccination policy in the Supreme Court, has told the court to leave the decision regarding the vaccination policy to the executive in the larger public interest, and that no judicial interference is in fact called for. Vaidyanathan joins us with the very latest. Vaidyanathan, very interesting to note these developments. The centre there telling the Supreme Court to leave the vaccine policy to the executive.
See, the three-judge bench is set to hear all the issues connected to the vaccine pricing, bed availability, etc. Last time, the court has asked the centre to revisit the vaccination policy, including the pricing. So, in a late-night affidavit filed yesterday by the central government, basically says that it's defending the policy, says that in the larger public interest, court should not interfere in the executive policy. It goes on to say that the vaccine policy is based on expert and scientific advice, decision taken at the highest level, and it says that these steps are taken in the public interest and court should not interfere. And it goes on to say the centre is in consultation with the other vaccine manufacturing companies abroad. So soon a decision will be taken. On the pricing, centre says pricing of vaccine is not only reasonable but uniform across the country. A three-judge bench would be hearing this today at 11 a.m.
All right, so that crucial hearing will in fact be taking place at 11 a.m. We'll keep a close watch on those developments. But interesting to note that the centre there defending the vaccination policy in the top court in that affidavit that was filed last night, also asking the Supreme Court to leave the decision regarding vaccination to the executive in larger public interest. No judicial interference, the centre says, is called for in the matter. Well, India's recorded 4,03,738 COVID cases yesterday, over 4,000 deaths in the last 24 hours. It is for 2 straight days that India is officially reporting a death toll crossing the 4,000 mark. There are 2.22 crore, which is the total caseload in the country. The positivity rate at the moment stands at 21.6%. All right, so what really is behind the surge in cases and deaths in the second wave? The World Health Organization's chief scientist has said a Covid-19 variant spreading in India is more contagious and may be dodging vaccine protection, contributing to the country's explosive outbreak. Soumya Swaminathan has said that the B1617 is likely to be a variant cause of concern because it has some mutations which increase transmission, which also potentially could make it resistant to antibodies that are being generated by the vaccine currently. Well, now the Tamil Nadu government has imposed a 2-week complete lockdown in the state. This, of course, in lieu of the rising Covid-19 cases. Sam Daniel joins us with the very latest. Sam, what more can you tell us? What's going to be open? What's going to be shut over the course of the next 2 weeks?
Rishika, we come to you from the Lust Corner in Mylapore, and if my camera person can pan, this is what you see. All the shops are completely shut and police have also erected barricades, except shops selling food, medicine, vegetable, fruits, milk. All other shops would remain shut, and even these shops ought to shut down by 12 o'clock. No liquor shops. Restaurants cannot have dining. They can have only takeaways at designated hours. And home delivery by Swiggy, Dunzo or Zomato and these platforms is available. And at the moment, even vaccination drive, people can show their bookings and go ahead for vaccination. And in Chennai alone, police say they will deploy around 10,000 police personnel to ensure that the lockdown is implemented. Chief Minister M.K. Stalin has designated 22 ministers in 14 hotspot districts to ensure the lockdown is implemented totally. And I have with me Dr. DDPR David Prasad from the Apollo Hospitals, who has been treating COVID patients for a long time. Doctor, how will this kind of total lockdown in Tamil Nadu help?
Well, what we are now witnessing, I don't think so, is just going to be a second coronary wave. I hope it's not a tsunami. So what we are trying to do is we are understanding that the cases are increasing so very rapidly. Currently, all hospital ICU beds and oxygen beds are being occupied, and therefore we do not have the infrastructure to deal with an additional load. I know we can scale up and increase the number of ventilators, just maybe in a day make up makeshift hospitals. We are importing a lot of oxygen tanks from UK and France, and industries are pitching in to increase oxygen. But the real question is, do we have the manpower to tackle it?
What is the situation in government hospitals? We know there are no beds, but how do you really tackle them?
Well, I think they're scaling up massive time, and they're redeploying people who are working in other areas to also come and take of critically ill patients. But I think that will help only in treating the mild and the moderate cases. But when you have the severe cases, you need to have people who are experienced in treating those critically ill patients, ventilated ill patients, both doctors and nurses, who are currently overstretched with the number. They may not be able to give the important time that we need to give for each patient to make the critical decisions. So we need to have a lockdown to break it. To put it better, I think we are in Chennai, we are having breakfast. Breakfast time, I think idli is a favorite breakfast. I think you and I would love to have idlis. 5 idlis over 15 minutes, I think we will relish. But if you are asked to eat the same 5 idlis in 1 minute, I think it's impossible. We get suffocated. So that's
Thank you very much, Doctor, for your time. And it's the first challenge for the new government. Rishika, already Chief Minister M.K. Stalin has announced 2,000 rupee relief for the poor people, hoping that will give them some kind of relief. But he has said it's going to affect the common man very hard, but this is the only way to break the chain.
All right, very interesting to note those developments. Appreciate you, Sam, for joining us with the very latest. A 2-week strict lockdown, remember, has been imposed in both Tamil Nadu and Karnataka. Let's now get you an update from Karnataka, where the numbers are especially concerning. The positivity rate in the state has shot up to 32.7%. There have been nearly 48,000 new cases and 500 deaths that have been reported in the last 24 hours. Bengaluru's positivity rate is down to 38.6%. The city has reported 20,897 new cases in 24 hours. Now, Karnataka begins the next phase of lockdown starting today until the 24th of May. The state has already been in a state of shutdown for almost 2 weeks, but some extra restrictions are in place now for the state, which has seen this massive spike in cases. So it is going to be extremely interesting to see how this lockdown plays out as far as Karnataka is concerned. This, remember, is a state that is presenting a huge spike in COVID-19 numbers, 48,000 new cases, 490 deaths in the last 24 hours. Positivity rate in the state of Karnataka has shot up to 32.7%, which is 10% higher than Delhi at the moment. And Bengaluru, which is of course a city which is also reporting the highest active caseload, has seen a rise of over 20,000 cases in 24 hours. All right, the other state which has now extended a lockdown is the state of Haryana. The lockdown has been extended at the moment for a period of a week. Stringent measures will be taken to contain the spread of Covid-19. A ban is going to be imposed on gatherings of over 11 people. Weddings will be allowed to be conducted at home or in court with a maximum of 11 people. Movement of a barat or a wedding ritual has been banned. All right, so while lockdowns are being extended and imposed in several parts of the country, there is good news that is coming in from Mumbai at the moment. The city's positivity rate has fallen to 7.3%. 2,400 new cases in the last 24 hours. 68 deaths have also been reported in Mumbai, but the recovery rate in the state of Maharashtra overall has crossed 90%, and Maharashtra reporting a rise of 48,400 new cases and over 572 COVID deaths in the state. Remember, Maharashtra was one of the first states to have gone into a total lockdown. Meanwhile, let's get you an update from Delhi, where the situation appears to have become slightly better. There are 13,300 new cases in 24 hours. 273 deaths. Now, this is the lowest number of new cases in a day after the 12th of April. 11,000 cases were reported on the 12th of April. However, new cases seem to also be decreasing due to a lack of testing. The positivity rate in the national capital has come down to 22% in the last 24 hours. Arvind Gunasekar, tracking the details of this story, joins us. Arvind, it is good news as far as Delhi is concerned. With the positivity rate dipping, it's still very high at 22%, but the positivity rate has dipped. But the worrying story here is that testing seems to have gone down.
Yeah, Rishika, if you could check the last 24 hours data that have been put out by the Delhi government, it shows that almost 14,000 cases, almost 13,336 cases have been reported across the state national capital in the last 24 hours. And if you could check the test conducted, it's hardly 61,000. Usually there was a time when the tests were somewhere lingering around 80 to 90,000 tests per day, but it has considerably, it has come down to 61,000. So, and if you could check the positivity rate, it's somewhere around 22%, 21.67%. So earlier the positivity rate was nearing 30%. From there it has come down to 22% now. But again, most worrying thing is again the steady increase in the deaths. Also, almost 273 people have succumbed to the infection in the last 24 hours. So, though the government says that the positivity rate is climbing down, again the fatality rate, again the people who have succumbed to the infection is over 250, and also the positivity rate, positive cases is also again 13,000. So again the positivity rate is, though the government is saying that it has climbed down, but the experts say that still it's over 20% and still it's alarming rate. So that's something that the government is trying to break the chain of transmission, and that's why the government has extended the lockdown in the national capital for next one more week. Rishika.
All right, Arvind, appreciate you for joining us for the very latest. Remember, the lockdown in Delhi has been extended by a week, and it's a stricter lockdown with metro services that have also, in fact, been suspended for this 1 week. Moving on, at Delhi's Saroj Hospital, there are around 80 medical staff who've tested positive for COVID between April and May. One surgeon, Dr. A.K. Rawat, who is just 58 years old, has received both doses of the vaccination, also succumbed to COVID-19 yesterday. In his last conversations, the surgeon said, "I will be all right." This grim news comes at a time when the hospital is already overburdened in lieu of the rising numbers. NDTV spoke with the Chief Medical Officer. This is what they had to say.
Close to 80 medical personnel and a surgeon at Delhi's Saroj Super Speciality Hospital tested positive for coronavirus in just the last month. Dr. Anil Kumar Rawat, a senior consultant and a surgeon at the hospital, succumbed to the deadly virus. Dr. Rawat was administered both doses of the vaccine, after which he contracted COVID.
ये जो पॉजिटिव है, ये ऐसा नहीं है कि आज ही सब पॉजिटिव आ गए।
जी, right.
The disease started mid-April, early April से लेके आज तक तकरीबन 80 के आसपास हमारा स्टाफ, इंक्लूडिंग डॉक्टर, पैरामेडिकल स्टाफ, एडमिनिस्ट्रेटिव स्टाफ सब मिलाए अगर तो करीबन 75-80 के आसपास पॉजिटिव आ चुके हैं। उसको 2 डोज लगे थे जैसे सबको लगते हैं।
ओके।
1 डोज इन जनवरी, 1 डोज इन फरवरी,
In his last days, colleagues remember Dr. Rawat, who served the hospital for 26 years, as someone who put up a brave fight.
He said, yes, I am having COVID, I am having respiratory problem, but I need to have my testing. I got vaccine.
The private hospital just last month had moved the Delhi High Court seeking directions for immediate supply of oxygen, but the Chief Medical Officer clarifies there is still anxiety.
There is little improvement in getting the oxygen.
Okay.
One thing is upsetting is that anxiety is always there when we will get the next lot of truck for oxygen.
The city's hospitals are stretched, but at the same time reporting its own staff being tested positive for COVID. But the medical fraternity too has reached its exhaustion point and also mourning the loss of their colleagues. In Delhi, with camera person Ashok Mahale, Shunakshi Chakravarti for NDTV.
Well, let's now shift our focus and get you the big development from Punjab. The oxygen emergency in Punjab is witnessing an escalation, and to add to the rising caseload that's pushing the demand for oxygen up by almost 60 metric tons in the first 8 days of this month. The Indian Air Force has indicated that the transport of oxygen tankers by air might take a hit on May 11th and 12th due to adverse weather conditions. Punjab has consistently been struggling to lift its entire quota of medical oxygen allocated by the centre due to logistical constraints.
As cases rise in Punjab, many like Sarabjit Singh have had to struggle to get their relatives admitted in a private hospital with a guaranteed supply of oxygen.
असल में देखा जाए तो ऑक्सीजन लेवल की इतनी शहर में कमी है, इसके ऊपर सरकार को एडमिनिस्ट्रेशन को ध्यान देना चाहिए। हमारी किस्मत अच्छी थी कि हमें ऑक्सीजन वाला बेड मिल गया। मुझे नहीं पता कि हमारे बाद के कितने पेशेंट जिनको ऑक्सीजन की बेड की जरूरत होगी वो क्या इस हॉस्पिटल से भी वापस गए हैं या उनको मिला है।
The number of COVID patients and oxygen consumption in Punjab has seen a steep spike in the last 2 weeks. On April 21st, there were 2,994 COVID patients in hospitals across the state, which increased by more than thrice to 10,151 by May 7th. Critical COVID patients up by 23% in the same period. On April 30th, oxygen consumption was 203.8 metric ton, which touched 250.6 metric ton in 1 week. The centre's allocation of oxygen to Punjab is 227 metric ton. Despite the allocation of 227 metric ton of oxygen, Punjab has not been able to lift the allocated quota due to logistical constraints. Punjab would need 36 tankers to lift the entire allocated quota from other states and 3 to 4 IAF sorties daily. At present, Punjab has only 18 tankers to lift oxygen from Bokaro, Panipat and Roorkee.
What we need immediately is allocation of 50 metric ton of oxygen in next 1-2 days and इतना ही ऑक्सीजन का allocation अगले आने वाले 4-5 दिनों में और होना चाहिए। टोटल मिला के हमें 100 metric ton ऑक्सीजन चाहिए। आज हमारे जो इश्यूज हैं उनमें ऑक्सीजन के अलावा जो हमारे नेबरिंग स्टेट्स से जो प्लांट्स हैं वहां से हमारा allocation का भी बैकलॉग चल रहा है। These plants are because of different reasons they are not able to supply us the required allocation. दूसरा इशू है बोकारो जो हमारा allocation हुआ है वो बहुत दूरी पर है, वहां से टर्न अराउंड टाइम despite IAF helping us in flying our tankers there वो उतना efficiently possible नहीं हो सकता because आने जाने में टाइम बहुत लगता है।
A number of patients from the Delhi NCR region coming to Punjab for treatment has put the state's healthcare services under further pressure. Chief Minister Amrinder Singh's request to the Government of India to allow the state to import liquid oxygen directly was declined. Cases are rising every day as experts have predicted 10,000 daily cases in this month. And despite this, the oxygen allocation still remains an issue. And to overcome this crisis, states should be allocated medical oxygen as per the rising demand. With Mohammad Ghazali, Revati Hariharan for NDTV.
All right, with that, we're slipping into a short break. A lot more lined up. Stay with us. Welcome back. Let's now get you an update from West Bengal, which has recorded its highest ever new infections with nearly 19,500 cases being reported in 24 hours, over 120 deaths. So this means that there have been over 100 daily deaths in the state for the last 3 days. The positivity rate in Bengal is at 9%, and there are currently 1.26 lakh active coronavirus infections in the state. Monideepa joins us with the very latest. Monideepa, as of course ministers will be sworn in today as a part of Team Mamata Banerjee, they clearly have their task cut out.
Oh yes, indeed. I mean, look at the numbers, and for the whole last 6 days, the number of deaths has been, constantly over 100. Kolkata and the North 24 Parganas district are competing. We had 124 deaths in the last 24 hours. Before that, it was 127 deaths in the last 24 hours. So certainly in Bengal, perhaps as a function of the post-election situation, the numbers are just going up. I'm just looking at my chart, and on the 21st of April, that is about 10-20 days ago, 15-20 days ago, the number of new cases we had in the state was at 10,784. So doubling in this short span of time.
All right, Monideepa, appreciate you for joining us for the very latest. So the COVID situation there in West Bengal, the positivity rate in fact touching almost 9.05%. Well, on to the other big story that we're tracking. A woman from West Bengal who died of COVID-19 symptoms at a hospital in Haryana was raped by 2 men while she was going to join the farmer protest in Tikri, near the border with Delhi. This according to an FIR that was filed by her father. The police said that they formed a team to track down the 2 accused after the 25-year-old woman's father filed the FIR. According to the complaint, the woman came to the Tikri border from West Bengal on the 10th of April along with a group to join the farmers' protest against the new farm laws.
दस तारीख को हुगली से चली, ये वेस्ट बंगाल की रहने वाली थी। 11 तारीख को दिल्ली आई। उसके बाद जो इसके पिताजी ने बताया है हमें, उनका कहना ये है कि भाई मेरी लड़की 25-26 की रात को शिवम हॉस्पिटल में दाखिल हुई थी, जहाँ उसका कोरोना का ट्रीटमेंट चल रहा था, और 30 अप्रैल को वो एक्सपायर हो गई थी। उनके पिताजी का कहना है कि भाई मेरे से फ़ोन पे बात करती रहती थी, और उनकी इन्फॉर्मेशन के अनुसार यही है कि भाई मनुमिता का रेप किया है। अभी जांच शुरू की है, जो फैक्ट्स होंगे सारे सामने आए हैं।
Well, let's now shift our focus to the big story we're tracking from Madhya Pradesh. In Madhya Pradesh, those who've been caught violating the current corona curfew in the Burhanpur district were punished with 1 or 2 hours of physical training and lung bolstering exercises while ensuring social distancing. All right, with that, we're slipping into a short break. We'll be back with the top stories and headlines in just a bit. Stay with us. Lakh coronavirus cases, 4,000 deaths in 24 hours. It is for the second straight day that India is reporting over 4,000 deaths. Mumbai city's daily positivity rate dips to 7.3%. In Karnataka, it goes up to 32.7%. After a massive spike in COVID-19 cases, a 2-week complete lockdown has been imposed in the state of Karnataka and Tamil Nadu starting today. Delhi and Haryana lockdowns have been extended to the 17th of May. Delhi has suspended metro services for 1 week too. 80 staff members at a Delhi hospital test positive for COVID in a month. 58-year-old surgeon dies despite both shots of the vaccine. The central government has defended the vaccination policy in the top court, has said leave it to the executive. Himanta Biswa Sarma to be sworn in as the next Chief Minister of Assam. 8 to 9 other ministers could also be sworn in today, say sources. 43 ministers will be sworn in as a part of Mamata Banerjee's team as she begins her third term as Chief Minister of West Bengal today. Welcome back. 43 ministers are likely to be sworn in today. Mamata Banerjee will take charge as the Chief Minister of West Bengal for the third time. This is the big developing story that we're tracking. The swearing in will be taking place at 10:45 a.m. at the Raj Bhavan. Two ministers will be sworn in virtually as one of them is working from home and one of them is recovering from COVID. Monideepa joins us with the very latest. Monideepa, this is of course the big political story of the day. 43 ministers are going to be sworn in today.
That's right, and all this will happen at the Raj Bhavan starting at 10:45 a.m. and I'm assuming it will take some kind of, certain amount of time. On the 5th of May, Mamata Banerjee was sworn in the Raj Bhavan as well by the governor, Mr. Jagdeep Dhankar. The 43 names are very interesting. 25 are incumbent faces. People who have been ministers are being sworn in as ministers once again. 25 of them. There are 18 new faces. And 9 of these 43 will be ministers of state. And the interesting faces are, people like Manoj Tiwari, the cricketer. He is Minister of State. He will be sworn in. Birbaha Hashda, she is a star of Santali cinema. She contested for the first time from, Western Nagpur area, and she has won, and she's also being sworn in. The others who are, certainly worth watching out for is the former IPS officer, Humayun Kabir. He quit the service just before the election and, contested, and he is also going to be sworn in today as a full minister. Veterans, Subrata Mukherjee, Partho Chatterjee, Firhad Hakim, Arup Biswas, Chandrima Bhattacharya, Shashi Paja, they are all back as ministers. A couple of other interesting ones is there is one Mr. Akhil Giri, who is from East Midnapur district. He is joining the ministry for the first time. Remember, East Midnapur is where Shubhendu Adhikari held sway till the other day, and even now he is MLA from Nandigram. Akhil Giri is the one from the party who had been a loyalist, and Mamata Banerjee seems to have rewarded him for that. There's also an additional twist in today's swearing in. Just last week, the governor, Mr. Jagdeep Dhankar, has sanctioned the CBI prosecution of 2 of the ministers that he will be swearing in. Subrata Mukherjee, Firhad Hakim, they now face prosecution in the Narda sting operation case. And there is quite a lot of chatter about how the governor has sanctioned their prosecution just ahead of the swearing in today.
All right, appreciate you, Monideepa, for joining us with the very latest. That swearing in will be taking place at 10:45 at the Raj Bhavan. We will continue to track the very latest. Meanwhile, the West Bengal Governor Jagdeep Dhankar has given the CBI permission to prosecute Trinamool Congress leaders Suwan Chatterjee, Firhad Hakim, Madan Mitra and Subrata Mukherjee. This comes less than 24 hours before Subrata Mukherjee and Firhad Hakim are to be sworn in as ministers in Mamata Banerjee's cabinet in a short while from now.
Yeah, Sarah, in fact, the West Bengal governor has given a prosecution sanction to the Central Bureau of Investigation. The Central Bureau of Investigation had approached the governor, West Bengal governor, to file a charge sheet against all these 4 TMC leaders, including Firhad Hakim and also Subrata Mukherjee and also Madan Mitra and also Suwan Chatterjee. Against all these 4 people, the Central Bureau of Investigation had approached the governor seeking prosecution sanction, only with the prosecution sanction from the governor, because during that particular time they were the ministers. So seeking the prosecution sanction, the Central Bureau of Investigation wanted to file a charge sheet against all these 4 people. But what we are being told by our sources, top sources in CBI, is that the governor has given a prosecution sanction under Article 164 against all these 4 individuals. What is also very interesting is that this is not the only, these four are not the only accused, only people named in this Narada case. There are other people, including Suvendu Adhikari and others also. Their prosecution sanction is pending with the Lok Sabha Speaker for last 3 years. But this time, the Central Bureau of Investigation approached the West Bengal governor in January. But now the West Bengal governor, within a span of 3 to 4 months, the governor has given the sanction to prosecute all these 4 people.
All right, on to the big political development from Assam. Himanta Biswa Sarma is all set to be sworn in as the next Chief Minister of Assam. He's been looked at as the BJP's Man Friday for the Northeast, and he's been rewarded with a plum post of Chief Minister. Council of Ministers is also going to be sworn in. The BJP Chief JP Nada is likely to be present at the swearing-in ceremony.
A change of guard in Assam's BJP government. Outgoing Assam Chief Minister Sarvananda Sonowal all smiles as he congratulates his successor and former cabinet colleague, 52-year-old Himanta Biswa Sarma.
हेमंत बिश्वा शर्मा जी के नाम का प्रस्ताव विधायक
Despite securing a second term for his party, Sonowal could not ensure another innings for himself as the Chief Minister. In the run-up to the polls, the BJP did not project Sonowal as a CM face. And after the big win, the party decided to reward Sharma, who has strategized the party's success not only in Assam, but across Northeast in the last 5 years.
আমি যে প্ৰতিশ্ৰুতি দি নিৰ্বাচনত বিজয়ী হৈছিল সেই প্ৰতিশ্ৰুতিবোৰ পালন কৰাৰ দায়িত্ব আমাৰ ওপৰত অহাকালিৰ পৰাই আমাৰ দায়িত্ব আৰম্ভ হ'ব জাতিটোক আমি প্ৰাণ দিব লাগিব জাতিটোক আমি ভাৰতৰ সৰ্বশ্ৰেষ্ঠ জাতি হিচাপে নিৰ্মাণ কৰিব লাগিব আমি ভাৰতৰ বুকুত এক উজ্জ্বল ৰত্ন হিচাপে
For now, Sonowal will remain in Assam as a margdarshak or mentor. But according to party sources, he may once again be given a national role. And while Sharma and his Council of Ministers are to take oath of office on Monday, party leadership is quick to establish that there is no animosity in this leadership handover.
Definitely, it will be a very smooth kind of thing will ahead. Nothing confrontation, no difference between any group or any person. All are committed to do work for the party, do work for the state, and we will do.
The Assam Legislative Assembly will soon have a new leader of the House, a new Chief Minister, Himanta Biswa Sarma, a man who perhaps was a Chief Minister in the waiting for a long time. But the task ahead for him is not easy. There is huge expectation from him, and then first he has to fight COVID situation, which is turning grim with every passing day in Assam. In Guwahati, Ratnadeep Chaudhary for NDTV.
Ratnadeep joins us with the very latest. Ratnadeep, Himanta Biswa Sarma is going to be sworn in today. The week-long suspense has finally ended.
That's right. It is going to be a landmark moment for Mr. Sharma himself in his political career, as well as for the BJP and for the people of Assam, because they are finally going to get a new Chief Minister, a new government is going to take charge, and this was the need of the hour given the fact that Assam is also witnessing a rapid increase in the number of COVID cases, and that's why perhaps a new government was the need of the hour. 1 week wait, and people were getting anxious. Now Mr. Sharma is going to be sworn in around 12 noon, along with 8 to 9 of his new cabinet members. This will also include at least 2 from LIAGP and at least 1 from UPPL. Now BJP National President JP Nada would be present in the swearing-in ceremony along with top BJP leaders, as well as at least 6 to 7 chief ministers from BJP rule state or states in the northeast where BJP is in alliance. They are also going to join this swearing-in ceremony. Now, the swearing-in ceremony will take place under COVID norms, and therefore, the ceremony which is going to take place at the Srimanta Shankardev Kalakshetra Auditorium in Guwahati, only 50% occupancy is allowed, and there would be strict COVID norms that the state government is telling us. Now, Mr. Sharma, who actually started his political career from college, he has been a former student of the prestigious Cotton College in Guwahati and has been the General Secretary of the college for 3 consecutive terms. That was the beginning of his career, and then on to he was a member of the powerful All Assam Students Union. Then he joined the Congress, where in 2001 he became an MLA for the first time from Jalukbari constituency. He has won for 5 straight terms, was a powerful minister in the Tarun Gogoi cabinet until he fell off with Mr. Gogoi, left the Congress to join the BJP, and in the last 5 to 6 years he has scripted not only BJP's victory in Assam, but its the political clout that BJP holds across Northeast, and therefore perhaps the BJP leadership has rewarded him this time.
All right, we'll keep a close watch on all those political developments from Assam. Appreciate you, Ratnadeep, for joining us. We'll keep coming back to you for more updates. Short break here on the broadcast. We'll be back with more. Stay with us. Welcome back. In December 2020, Israel initiated a national campaign to vaccinate its population with the Pfizer-BioNTech mRNA COVID-19 vaccine. Israel's health ministry recommended a 2-dose schedule with a 21-day interval. By the 19th of April 2021, 54% of the entire population of over 9 million people had been given the first jab. 88% of the population aged 50 years and older had received 2 doses. Vaccines were rolled out around the same time of Israel's 3rd and largest wave of COVID-19 infections, with a peak 7-day moving average of around 8,328 infections per day. Now, Israel's reported a rapid decline in COVID-19 cases across all age groups, despite the easing of lockdown restrictions and reopening of education and commerce. By the 19th of April 2021, the 7-day moving average of new cases dropped to 149 per day, indicating the effective control of the pandemic within the country's border. The marked reduction in new cases prompted the Israeli government to ease nationwide restrictions, including the discontinuation of face covering use in open spaces. Now, Lancet's findings from Israel suggest that the high vaccine coverage rates could offer a way out of the pandemic. Israel's experience provides impetus for countries to proactively pursue a high vaccine coverage policy. Now, the ambassador of Israel has spoken to India. This is what he had to say.
As we reflect on our situation in India, on the overall COVID situation, it's also important to look at what is happening in those countries that appear to have genuinely won a large part of the battle against this virus. Israel is one of those countries, a country that continues to provide India with a lot of aid as well at this hour. But Israel itself took the battle to COVID last year, aggressively vaccinating its population with the Pfizer vaccine. By April, 54% of the entire country and 88% of people aged 50 and older had received both jabs. And now Israel is carefully telling its citizens that they can unmask in situations in public, in the open, and that schools are now open as well for students. Joining us now to tell us not just about the remarkable story of Israel as the world goes through this crisis, but also to reflect on the aid which Tel Aviv is providing New Delhi. Remember, Israel and India are very close strategic allies. Dr. Ron Malka, the ambassador of Israel to India. Thanks, Dr. Malka, very much for speaking to us. My first question, there's a lot of aid coming India's way right now. What are some of the areas of aid that you're focusing on just now?
Good evening, and thank you for having me. Well, we are mostly, focusing on support of equipment that is engaged with oxygen supply. So it's oxygen generators, oxygen concentrators in many shapes, and also I would say breathing technology, advanced breathing technology that we can provide, respirators, advanced ones, whatever we can just provide to extend the ability to provide more oxygen to those who need it at time.
And Ambassador, where is the aid going? Where are the oxygen generating plants going?
Well, it's going all over. Since we open few avenues of collaboration. It's not only a G2G collaboration. Most of it is G2G. So the government of Israel collected with a special task team that was designated by the Minister of Foreign Affairs, led by the Minister of Foreign Affairs, but with many disciplinaries. We sent G2G thousands of oxygen generators and concentrators to the government of India, the central government, and they decided divide it with the Red Cross. But only many other initiatives. All the private sector is also on hand with the public sector in Israel. All the people of Israel looking, searching every corner. Take, for example, Startup Nation Central Association that not only donated money, but also sent its people just to collect as much as equipment as we can from different places in Israel. So we are going to every corner. It's both the public and the private sector, private people, NGOs, all kinds of organizations, the Indo-Israel Chamber of Commerce, the Israeli Export Institute, so many organizations in Israel are on hand and doing whatever they do, searching every corner to send as much as oxygen equipment to India. And we send until now, today was the third aircraft, cargo aircraft with thousands of generators and more to come.
Right. Well, that sounds fantastic. Ambassador, tell us a little bit about the remarkable story in Israel. How did Israel decide to fight COVID?
Well, we realized in the first beginning of the pandemic that what we need to do is to ease as much as we can the curve of infection until we get a vaccine, until a reliable vaccine will be developed. Once this vaccine was developed, we started with a very massive operation of vaccinating all the population. We managed to vaccinate in less than 3 months more than 90% of the eligible population for vaccination. And I think this is what works so well for us. That's how we came now to a stage that there is almost not an infection, or a few cases every day. The economy is totally open. We even let people, as you mentioned before, outdoors, not to wear masks, only indoors. And everything is open, schools, but all the economy, the businesses, everything is open. And now we are trying to keep this as it is now.
Ambassador, when Israel went about with its vaccination strategy, were people asked to come to vaccination centers, or did your doctors go to areas and communities and vaccinate them proactively there?
The thing is that since the establishment of the State of Israel, we decided to focus on human resources. We didn't have any natural resources. We start our nation from scratches. So we focused on education and healthcare, public healthcare. So we have very good, very efficient public healthcare facilities that are already there from the beginning. So each and every citizen needed to go to the center of public health in his neighborhood or whatever it is, and to get the vaccine. We just spread it all over the country, very well regulated and organized. So everyone that wanted and was available for vaccination got the vaccine.
And so now people are out on the beaches? Is that what's happening now? I mean, sooner than later, out in the open without a mask?
Yes, the beaches are full now. People are without masks. Not only the beaches, all the public places. Yes, people, life is back to almost as normal as it was before the pandemic. Almost, I say, because there has been some changes.
Sure.
But mostly everything is open. The outdoors, nobody wear a mask, only indoors. And that's how it is now.
And schools are open as well, and that's so important for a younger generation.
Schools are totally open. But as I said, many people now in Israel are focusing on supplying. It touched so much our hearts, and we feel so connected and so strong emotionally connected with India. So many Israelis, I get tens of thousands of approaches and emails, messages of people in Israel that just want to contribute to help, to assist as much as they can with any equipment that they have. We now even renewing oxygen concentrators, different places. And after a quality test, we send them to India. So it's people-to-people effort and operation, and it warms the heart. And that's what we are focusing now. So it's not, even in schools, whoever can contribute, whatever they can do now, since understanding what is the situation now in India. I myself here with this special task team, but we get so much help. Everyone is on hand in Israel to see how we can support and help our friends back in India. And we don't forget that when this pandemic just broke out, India stood with us and helped us, first evacuating thousands of Israelis that were stranded all over India, providing us with medicines, with protecting gears, whatever we needed that we didn't have in Israel. This is the reflection of genuine friendship, and we know how to appreciate it very much. And now we show again how strong this friendship is, and how it's getting stronger and stronger from day to day.
Ambassador, it's such an important part, the emotional connect between our people. This time of the year is when we see hundreds, if not thousands, of Israeli nationals all over, for example, parts of Kashmir or Goa, elsewhere on their motorcycles, going up and down from Srinagar to Kargil and on to Leh. And they are so much a part of that entire area among so many other areas, and people have come to accept them very deeply. It's so sad that they won't be there this year, right? At least not for the foreseeable future.
Yes, but this is only temporary. I think that as much as the vaccination operation in India will advance and proceed, you will have the same results as we have in Israel. So it's mostly about vaccination. Vaccinate, vaccinate, vaccinate. That's eventually what gives the real protection and stop the infection and really beats this pandemic. So vaccinate, vaccinate, vaccinate. This is our experience. We are now working on sending delegations of experts from Israel to share our knowledge, our achievements, our experience fighting this pandemic. It's not only about equipment, it's also about the experience that we share and expertise. So we are working on sending delegations of doctors and experts for fighting corona to India to assist as much as we can.
One or two more questions, Ambassador. Israel moved very quickly last year to acquire or to procure large doses of Pfizer. How was that key to your strategy, that you knew you had to vaccinate, so you needed to acquire? And you spent money on that, right? I mean, there was an outlay and you spent and you bought. Tell us about the thinking at that stage.
This is what we call very well spent money.
Yes.
Yes, with good income and profit, yes, yes. So once we realized that this is going to be the solution, whatever we did was temporary, just to ease, as I said, the infection curve, but eventually in order to beat the pandemic, we need this vaccination. Once we realized that, yes, we reached out to those that produced the vaccine and made contracts. We were the first to make those contracts and to buy this vaccine. We paid very good price, but I think that it was one of our best investments, although we paid so much.
And Ambassador, of course, now there is no civil air traffic between Israel and India. You have very strict safeguards, obviously, in your country as well. Are you worried about this India mutant getting to Israel one way or the other?
What getting to Israel?
The mutant, the double mutant.
So, it's not only India. I must say that we now understand that there is some dynamic with this misleading virus. And new mutants and variants are arising in different places in the world. And we understand that if you want to keep our achievements, we need to be very, very careful and really controlling those that are getting to Israel to see that we don't get any new variants and hopefully not variants that this vaccine that we have cannot give protection to, because this also might happen. We don't have any evidence for that as of now, but all the experts say that it might happen because this virus has such kind of dynamics that we might find ourselves approaching a new variant that the vaccination that we have will not give protection. And that's what we are very concerned of. And that's why for many other countries in the world, we control and regulate those that come in, just to see that we don't bring any more variants and keep our achievements.
All right, Dr. Malka, thank you very much for speaking to us, and thank you so much for your help. And this close relationship between people is something that really truly does define our equation. Thank you very much, sir, for being with us.
Welcome back. You're watching Good Morning India. I'm Rishika Barua. The central government has filed an affidavit in the top court late last night and defended its vaccination policy. The centre defended the vaccination policy in the Supreme Court by telling the court to leave the decision regarding the vaccination policy to the executive in the interest of larger public good. No judicial interference is called for, said the centre. Vaidyanathan joins us with the very latest. Vaidyanathan, what more can you tell us?
In the last hearing, the Supreme Court asked the centre to revisit the vaccine policy, pricing and other issues. So late last night, the central government has filed its affidavit in the Supreme Court. As you rightly said, number one, it says no need for judiciary to interfere because the decision taken on scientific and expert advice and on their opinion. So even overzealous to well-meaning interference by the judiciary may lead to unforeseen and unintended circumstances. This is the exact word the affidavit says. It says if any law is made, Supreme Court very well check the validity and may quash it. But these are executive, decisions. Even Supreme Court in its earlier decisions, number of decisions said that court should not enter into the parliament domain or the executive domain as far as the policy is concerned. So basically, the centre is saying we are taking all precautions. Whatever being done is done. But judiciary, we respect your advice, but keep off from the executive decision, particularly during this pandemic. The affidavit also says that all the citizens in the country will be getting free vaccine because states have already declared that they would supply to the citizens free of cost. And secondly, it said because of the government persuasion with the two vaccine companies in India, the price have been lowered. Also, government is in consultation with the companies abroad for vaccine production. So these are the few points. Anyway, the Supreme Court bench, a three-judge, Justice Dhananjay Chandrachud, Justice L. Nageshwar Rao, and Justice S. Ravindra Bhatt on the three-judge bench would be taking up this case at 11 a.m. today.
All right. So as far as the vaccine policy is concerned, the centre, they're telling the Supreme Court no judicial interference is called for and that they should leave the decision to the executive. Appreciate you, Vaidyanathan, for joining us with the very latest. This coming in at a time when India's recorded over 4 lakh fresh coronavirus cases, over 4,000 deaths now for 2 straight days. The overall caseload in the country has crossed the 2.2 crore mark. The positivity rate in India stands over 20%. In fact, it is 21.6%. Let's get you an update on what's happening as far as the national capital is concerned. There have been 13,000 new cases that have been reported. 270 patients have died. This is the lowest number of new cases that has been reported since the 12th of April. However, the big question is, are new cases decreasing due to the lack of testing? Arvind Gunasekar, tracking the details of the story, joins us with the very latest. Arvind, the positivity rate in the national capital has dipped. This is a good sign. There's been some relief. But the big question that many are asking is that, is the decrease in the number of daily cases due to a lack of testing?
Yeah, Rishika, if you could check the data that has been made public by the Delhi government, in the last 24 hours, over 13,000 people have tested positive for the COVID infection. Almost 61,000 people were tested during the same period. So the positivity rate is somewhere around 21.67%. Though the positivity rate has decreased from 30% last month to 21.6%, almost 22% now. But even that 22% is extremely high. That's what the experts are pointing out, saying that we should not lower our guard. Like you mentioned, the cases have reduced from almost 30,000 13,000 cases to 13,000 cases. 13,300 odd cases have been reported in last 24 hours. But that is also directly proportional to the decrease in cases. If you decrease in tests, if you could check the number of tests that were conducted in last 24 hours, it's somewhere around over 61,000 tests that have been conducted in last 24 hours. So for this, when we approach our sources in the Delhi government, what they are saying is that earlier there used to be somewhere around 90,000 tests per day. That was mainly because the markets were open. There used to be testing centers at the marketplaces, etc. Because all the markets have been closed, because the lockdown has been strictly enforced across the national capital, that's why those 30,000 tests have been decreased, and that's why the tests are somewhere around over 60,000 tests per day. So that's the justification. What they are also pointing out is that if the tests are decreasing the number of cases, then that should reflect in the positivity rate, but the positivity rate is also climbing down, it's also decreasing. That's the justification, that's the explanation. Coming to the number of people who have succumbed to this infection, it's still somewhere around 273. That's still a cause of worry. That's where the government is trying to intervene, trying to break the chain of transmission so that they can reduce the number of cases, and also at the same time they can reduce the number of fatality also. So the government has increased the lockdown in the national capital for one more week starting today. Rishika?
It is a stricter lockdown that's been put in place this time, Arvind, with the metro services also suspended for this week. Appreciate you for joining us with the very latest. Well, from Delhi, let's now shift our focus and get you the very latest from Mumbai, where there is good news coming in. The city's daily positivity rate has fallen to 7.3%. There have been 2,400 new cases and 68 deaths that have been reported in the last 24 hours. Let's take a look at what's happening as far as Maharashtra is concerned. The recovery rate in Maharashtra has crossed 90%. 48,401 new cases have been reported, over 570 deaths in the state of Maharashtra. Now, the numbers in Karnataka are especially concerning as well. The positivity rate in the state has gone up to 32.7%, with nearly 48,000 new cases and 500 deaths. And a 2-week lockdown, Maya, has been put in place. What more can you tell us?
That's correct. There was already a shutdown in place in Bengaluru and across Karnataka as well. Now it has been extended until 6 a.m. on May 24th in a bid to try and control the overwhelming numbers being seen by the state and Bengaluru also. What is allowed? Well, essential shops can work from 6 a.m. to 10 a.m. Now, vehicles are being discouraged in this phase, except in the case of emergencies. Vehicles are being asked not to actually move outside, and many vehicles have already been impounded in the earlier stage of the lockdown. Many vehicles were actually taken away by police because they were out when they had no reason to do so. People are encouraged, they're allowed and encouraged to go for their vaccinations. But this is only on appointment, 1844, only on appointment. And if in fact they can show the SMS to police that they have a booked appointment, a booked registration for their vaccinations, then police will actually let them go towards the vaccination. 18 to 44 vaccinations are happening in some main hospitals in Bengaluru. Well, milk booths and vegetable booths on push carts can be open from 6 a.m. to 6 p.m. in the evening. So marriages can have a maximum of 50 people, funerals can have a maximum of 5 people, and there have been a lot of funerals of late. Bengaluru actually crossed 8,000 deaths. And the case fatality rate has gone up a little bit to 1.02%. The city recording over 20,000 cases in the last 24-hour data. So, Karnataka once again in shutdown. The word shutdown preferred by the Karnataka government to lockdown until May 24th.
All right, appreciate you, Maya, for joining us with the very latest. Sneha joins us now from Kerala to get us the very latest. Sneha, the lockdown in Kerala is there till the 16th of May. It is day 3 of the lockdown, if I'm not wrong. What's it been like?
Well, let's just give you the scenes here. This is one of the main roads in Thiruvananthapuram, and you see police checking every single vehicle which is passing, whether it be a scooter, car, truck, whatsoever, is being checked for how important or essential the movement is. This is being strictly followed not only in the main cities but across districts. Around 25,000 police personnel have been deployed just for this purpose. This lockdown is being enforced extremely strictly, And this even as the test positivity rate in Kerala has crossed 28%. It's at 28.88%. Of course, the cases over the last few days have been relatively lesser, but that's also because testing have been lesser for different reasons, including the weekend. But the test positivity rate only increasing. Now Kerala has also ramped up certain measures to be able to deal with the surge towards the peak. They are expecting it during the month of May. Some of the efforts that they have taken, one includes all the fever clinics need to be turned into COVID clinics. What we are also being told is there's orders which have been given to the government hospitals across Kerala to be focusing on COVID-linked cases and only take the only take the emergency cases when it comes to the non-COVID cases. So that's one of the measures which is being looked into. Even taluk hospitals have been asked to prepare oxygen beds and if possible, if ventilators are available. So a lot of efforts on the ground to ramp up the infrastructure. This even as several districts are reporting private hospitals running full capacity. Especially when it comes to the ICUs, but unfortunately, this is perhaps the saddest thing, and that is even as cases are surging towards its peak, even in Kerala, vaccinations, the rate of vaccination has only dropped. A lot to do with the availability or lack of availability, and the slots just not being available at the COVID portal.
Well, absolutely, and the lack of vaccination continues to remain a huge cause of concern, not just in Kerala, but several other parts of the country as well. Sneha, thanks so much for joining us with that update. Let's now go across to our panel of expert doctors joining us this morning. Dr. M. Wali, Senior Physician, Gangaram Hospital, is with us. We also have Dr. Manish Singhal, Senior Oncologist, joining us from Apollo. Thanks so much, doctors, for being with us. Dr. Wali, if I can begin by asking you, the vaccination, the shortage of vaccination, especially for those within the age group of 18 to 44, continues to remain a huge cause of concern, as far as different states across the country are concerned. Some states haven't even begun rolling out the vaccination in this age group. Do you think this sets us back as far as our fight against this second wave is concerned?
Yeah, it's. I am very pained to say that the word shortage has come in. We were boasting to make too much vaccine for the world. And I myself tried COVID application last night, and all slots were shown full. There's no availability. So then I asked my son to check if there is any itinerary of the people going for the vaccination. So that provision is not there. In any case, you see, initially India was told a restricted supply to have for the raw material from the US. That ban has been lifted. Now we have more people coming in for vaccination and less number of vaccines available. We have included Sputnik, but I don't know how successfully it has reached to the ground, and that would probably complete some part of deficit. And the youngsters have been included, 18 plus group. So this all combined, it gives a very unsatisfactory picture of the vaccination.
Yes.
And people are trying to get vaccinated, they are not getting slots, or when they go, they find a inappropriate bill stuck on the wall. Today, no vaccination or vaccines not available. So this is very disheartening to me for a program which was so successfully started and now is showing a type of halt or a type of decreased performance sort of thing. And this is a sad situation.
All right, Dr. Manish Singhal, if I can come to you, and we also have Dr. Sarat Chandra, Professor Neurosurgery, joining us from AIIMS. But Dr. Singhal, first to you. Initially when the vaccination program started out, there was hesitancy. Now there's a sense of desperation, given what people are seeing as far as the second wave is concerned. Everyone, knows someone who's been severely infected. Most people know someone who's, lost someone in the second wave of COVID. We know it's been a lot more deadly. So when people are actually desperate to go out and get themselves vaccinated, there just aren't enough slots available, and I'm talking specifically of the 18 to 44 category. Given the fact that more younger people are being impacted in this second wave, how do you look at these developments?
I think it is very important that earlier people were very skeptical about taking the vaccination, and that was a very select population which was being vaccinated. So the overall success of the vaccination program was good. But now, when we know that a larger population is vaccinated, we are seeing a lot of deaths because of vaccination. There's more acceptance of vaccination, and now a larger population is to be catered. So we are finding that the vaccination program is not getting very successful. But I think we need to be slightly patient over here. And of course, I'm very sure that the authorities are working very hard. The vaccination production has been ramped up. We are likely to produce about 8 crore vaccines every month at the current rate, but with increasing number of vaccinations coming in, like Sputnik coming in, another vaccination being ramped up, I'm sure the program will become successful, but we need to be patient, because I think what is happening is that everybody is getting very impatient to get the vaccination done as soon as possible.
Yes.
But I'm sure that the vaccination program will start, and it will be very effective. The way it is being, the way we are hearing it to be.
Okay. What seems, however, to be working at least to a certain extent, Dr. Sarachandra, if I can bring you into the conversation, is public health measures like COVID curfews or lockdowns. If you look at the Mumbai positivity rate, it is down to 7.3%. There's been a decline in caseload in the state of Maharashtra. Hospitals are, are witnessing lesser daily admissions, even though there are still several critical patients in ICU. This is the backlog from the previous week. So do you believe that, given the fact that there is a shortage of vaccine supply, lockdown-like restrictions is our only way forward?
So thank you for asking me that question. So firstly, I would like to add a positive note about vaccine, that 10% of our population, 2.6% of our population, 10% of population have taken the first dose, close to 3% of the population have completed the second dose. These are not small numbers.
Yes.
These numbers, they include 50% of the population of US and practically the whole population of Russia. So they are immense numbers what we are talking of. And definitely, we are going to take some time for the vaccines to pick up. And like the earlier speaker was telling, the vaccine program is now being ramped up by Dr. Manish Singhal. The vaccine program is now being ramped up, and we are looking at close to 8 to 9 crores per month. And definitely in the next few weeks, we are going to see a huge change.
Yes.
But answering your question, I think the only way for us is A, vaccination, B, COVID appropriate behavior. The COVID appropriate behavior could be something which is acute, which includes the lockdown. And once the numbers are controlled, we need to have a chronic COVID appropriate behavior, which includes using masks, social distancing, and being aware of the situations where one can be exposed. And we also have to be aware of the fact that airborne transmission of what we are talking about, COVID, it's not similar to the airborne transmission of other diseases. It doesn't mean that, we start coughing and somebody away at 7 or 8. It means that basically if a person stays in a closed room for a period of 1 to 2 hours or 3 hours and he releases these aerosols, it can remain in the closed room for a period of 3 to 16 hours. That is what is meant by aerosol transmission.
Right.
That is the reason we have to avoid staying in closed spaces. We have to be in open spaces and well-ventilated spaces. I think these are the only options we have. We don't have any other options.
All right. Well, those are, I think, important points that you make. Thank you so much, doctors, for sparing your time and being with us on NDTV this morning. We'll continue to keep a close watch on all these developments. Short break here. We'll be back with more news on the other side. Stay with us. Welcome back. Let's shift our focus to the big political story from West Bengal. Monideepa joins us with the very latest. Monideepa, 43 ministers are likely to be sworn in today at Raj Bhavan. Mamata Banerjee officially taking charge as the third-time Chief Minister.
That's right. 43 ministers will be joining Mamata Banerjee in setting up the government in West Bengal. And of course, there are clear political signals in the list that has been put out of ministers. 43 of them, at least 9 of them will be ministers of state. There are many new faces, but there are veterans and loyalists who have also been rewarded in a way. The most startling, of course, or rather the most interesting entry into the ministry is of Mr. Akhil Giri. Now, he is a Trinamool leader from East Midnapur district. And remember, that is the district of Shubhendu Adhikari, the BJP MLA from Nandigram. And he used to be with the Trinamool Congress before. But Akhil Giri stuck through the thick and thin with the Trinamool Congress, and he for the first time has become a minister. He will be sworn in at 10:45 along with 42 others. The other interesting feature, of course, we all have been talking about how there's been a huge support for Mamata Banerjee from women. And including Mamata Banerjee, there are going to be 9 women in government. Some of the veterans are back, like Chandrima Bhattacharya and Shashi Paja, and there are new faces like Birbaha Hashta, a Shantali cinema superstar. She is going to be a Minister of State. All eyes on the swearing in, which also has a little twist, and that is just last week the governor has sanctioned the prosecution by the CBI of 2 of the ministers he will be swearing in today. He has sanctioned the prosecution in the Narda sting case, and there are many analysts who are saying this is all yet another step or yet another collision that is likely to take place between the governor and the chief minister.
All right, appreciate you, Manideepa, for joining us with the very latest. We'll keep a close watch on all those political developments from West Bengal. Short break here. We'll be back with more on the other side. Stay with us.